Guys, welcome back to Medical Coding with Blue. Today's episode is all about jobs to avoid if you are a brand new medical coder. If you are brand new to my channel, welcome. I am Blue. I'm a medical coder. Okay, guys. So the advice that I give today comes from my 17 years of experience. And, everybody, when you start out in the industry as a medical coder, you get certified, you're out there looking for a job. And then all of a sudden you start seeing all these places asking for 3 to 5 years experience. Everybody wants experience, but no one wants to train, okay? And how are you supposed to get experience if no one will hire you, okay? And so sometimes as new coders, it's possible that you may need to take alternative jobs to help you to get in order to be able to gain that experience. But this episode today is specifically for the jobs to avoid. These are the jobs that you do not want to get into because these jobs will not help you to use your skill. They will not help you to understand the process of medical coding or even the revenue cycle, okay? Because sometimes, some people want to do the revenue cycle and some people just don't want to do the coding. So it really all depends on what you want to do. But these jobs today that I'm telling you all to avoid are the ones that trap people and people fall into because they think, well, let me just get my foot in the door and let me just do this for a little bit and that will help me to make connections. The problem with some of these positions is if you are really good in these positions, they will not move you to another place in that facility because they need you to be in that place. Now, I have had people who disagree with me on this and people who have lots of education and they openly will disagree with me about this. And that is totally fine. I will respect you as long as you're respecting me. And the reasons that I am saying these things because I don't want people to waste their time. I have been in the industry, boots on the ground, to know the difference versus somebody who's been in only leadership and who only sees the bigger picture of, oh yes, let me get this person to do all of these different roles because I'm using them to my benefit and saying that it's for the betterment of that individual. It absolutely is not, because of the simple fact that every single day that individual is not using their skill as a coder is every single day that it's getting further and further from their mind that by the time they do get to a coding position, if they are not studying, which 99.999% of the time they stop, they will not be prepared for. And they will have gone through all of that for absolutely nothing. Now, I have seen somebody who asked me for my advice, went against my advice, went for somebody else's advice, and they're happily in that position. Well, not getting a single lick of experience in coding. Okay? So, whoever you listen to is entirely up to you, but I'm hoping that you all will hear me when I say that these employers will use you for your skill and not pay you. Or they will use you for your talents in other ways and they will not care that you wanted to get into coding. Because it is about them and it's about their company and it is about their business. So that's why I'm telling you all that y'all need to make sure that you're paying attention. Okay? Because I'm not here to sell a program. I'm not here to sell a company. I'm not here to sell anything. I'm just here to help people not waste their time. Okay? But if you want to waste your time, you go right ahead. But the number one job that I will tell y'all not to get into because it will not use your skill is patient access. Now, there's been people, oh no, that's how I got started, and oh no, that's how I made my connections. But that's not always the case. There's always exceptions to the rule. Those are exceptions and not the rule, because I have heard more often than not from people who have had the opposite experience of being in patient access. Patient access is patient facing. It is actually working with patients. It is checking them in. It is getting all of their documents and things like that and sending them with somebody to whatever section of the hospital that they need to be in. Okay, that is patient access. And because of this, you are not doing anything with coding. You are a trained medical coder And if you get into a position like this, just to get your foot in the door, if you are doing a stellar job and a position opens up in the coding department, do you think that HR will let you go to that coding position because that's what you wanted to do? That's what you're certified in? Do you think they're going to let you go? Absolutely not. Because it's very difficult to keep people in the patient access positions. That is a very high turnover position, simply because the fact that they get yelled at by the patients. There's not a whole lot that they're doing other than the same thing over and over and over again. So while working with the public may be fun for some, it's not always for others, okay? And so spending your time in a patient access position when you are a certified medical coder is a waste of your time, because it will not get you the experience that you think it will. And again, you could say that it's about making connections and all these and all that, but you really want to make sure that once you get your certification, that you hit the ground running and that you are using your skill as quickly as possible, that you are getting into a position where it's going to require it. This field is going to require you to be very stubborn and very persistent in what you want. This is not for the faint at heart. This is not for those with a weak stomach that will get so upset and crying over every little rejection. You will get rejected a lot. You will get rejected a lot in the beginning. And I do recommend that while you're on your search for jobs that can help you to use your skills as a medical coder, which I will go through on another video. But in the meantime, when you're looking for an alternative job because you just need to keep food on the table, make sure that it's in something that is not related, or not that you think that is related to coding, because this will give you that motivation to keep looking for a job in coding, or keep looking for an alternative job to get coding experience, rather than, oh, I'm going to stay here in patient access and I'm going to work that because that's going to help me to get my foot in the door because I'm already working in the hospital, not knowing that you could end up getting stuck there. Okay. And it's the same thing for people who get into medical secretary. They want to get into medical secretary because they say, oh, well, they are saying that they can let me work and enter the codes because I told them that I'm a medical coder. So I agreed to be their medical secretary. While medical secretaries are very important to the healthcare cycle because they take care of a lot of things, it's not appropriate for somebody who has been trained in medical coding to not only wear the hat of a medical secretary, but you also wear the hat as a medical coder, even if you're just selecting the codes. And by selecting the codes, because they're on a super bill, right? So you're just circling the codes, or you're entering them in. This isn't right either, because again, you're not getting experience in coding. That is just charge entry. And again, charge entry gives you exposure to the codes, and that's okay. But again, you're wearing two hats now. You're doing the alleged coding part, which is more charge entry, and you're doing the secretary part. And again, if they have you in this position and they like you in this position, you are not going anywhere. You are not going anywhere. They will keep you there. There's been a lot of people who have told me their sad story about getting stuck in a medical secretary position because of the simple fact that they thought it would help them. They thought they could get lots of experience. And they said, oh, it's just for a little while. Or, oh, the doctor promised me that they would put me in the coding position or the biller position afterward. But, they keep delaying and delaying. Okay. Well, that's because they're going to go based on their needs, not your needs. You need to look out for yourself. Medical secretary will not help you, because what are you doing as a medical secretary? You're scheduling patients. You're doing all of these things. It's like working at the front desk. Maybe you're doing the schedules for the doctor or their conference schedules and booking things and things like that. So that's very important, but again, not going to use your skill as a coder. And if you are using your skill as a coder, you are being taken advantage of, because you're not getting paid what a coder would be getting paid. And as somebody that's working as a secretary, you're not going to make the same amount of money. And don't ask me about specific dollars, because I never talk about specific dollars on my channel. But I'm saying if you go to the Department of Labor or the Bureau of Statistics, you will be able to see in your area what a medical coder makes versus what a medical secretary makes. And it is not the same. Okay? It is not the same. So again, with that said, you have to know that you are responsible for the positions that you choose to apply for. And applying for patient access or applying for a secretary, again, while these are useful and helpful positions in the healthcare cycle, it's not for you. It's not for somebody who has technical training. Because yes, a medical secretary may have gone to school for those types of things, but with patient access, it doesn't require you to have all of this specialized training. And if they say, oh, well, we want a college degree, somebody who has a college degree, that's somebody in HR that's putting that out, again, not knowing what this person really truly does need. Okay, because that's not a technical position. You don't need technical skill other than to work with a computer on a basic check-in system, okay, to be able to do something like that. So I will never, ever, ever recommend that somebody works in patient access, okay? Appointment scheduling is another one. Oh, well, again, I'm trying to get into the hospital and all they had open was a patient scheduler. The thing about patient scheduling, it is patient facing, okay? Even though you're not seeing the patient, you're just calling them on the phone. A lot of times these patients, they're already sick, or they have a caregiver who's already tired and they're not wanting to deal with this right now, or whatever the case may be. And so it gets very draining because people, when they think that they don't have to see you, will give you attitude. And so that's a problem, okay? And again, not going to use your skill. It's only going to wear you out because, again, you're working with the patients. And if somebody is getting into coding, that's not who they want to work with. They do not want to work with patients. They would like to work with the providers. And while you are working with the patients in a way, because you are making sure that their documentation is correct when you're working as a medical coder, again, being a patient scheduler is not it. That is not going to help you in your quest to become a medical coder. All right. And again, anything that you do that is going to get you into the industry that you think, and it's not where you're not actually applying skills or you're not actually getting that exposure to the codes, is going to be an exercise in wasted time. Okay. Just a wasted time. That's all it is. Okay. So that's the other thing that you have to know. All right. And like I said, I do recommend that if you are going to try to get a job right now, just to kind of pay the bills, that you're doing something that is going to continually motivate you to look for a job as a coder. When I first started in the industry and I had my credential, I had it for 2 months and I was looking for a job, going through the same thing that you all are going through of, well, you don't have experience, come back when you get experience, and, all that kind of stuff. So what I did was, I was still working, but every single day that I worked, I was in pain, because I was working physical labor jobs, I was working as bartenders, cleaning houses, and working in a halfway house, and doing all those things, and working 7 days a week, no days off, because I'm just trying to keep my head above water. And I was so exhausted that I just wanted to do what I was trained to do. I wanted to work in a nice, clean office. I wanted to read all day instead of having to deal with these crazy people that are talking to you all kinds of crazy ways when you're working in a bar. But, that was what I did, and so again, but having that motivation every day of, I don't want to keep doing this. I don't want to keep having to work in these jobs. Kept me going to say, I'm going to end up finding a job. And I ended up listening to my mom and, my mom telling me to go back to the school and see, what they could say, where can I go to get my first job? And I ended up going to a temporary agency. Now, if you Google temporary agencies for medical professionals in your area, you will see temporary agencies that are specific to medical professions, not temporary agencies for medical coders. I had a lady who said that. I have never said that. I have always said that it is temporary agencies for medical professionals, because those are the ones that get everything. They're the ones who get the temp jobs for the doctors, the nurses, the medical assistants, the medical coders, medical billers. Sometimes these temp agencies end up with contracts, coding contracts, and they need people, okay? And so that's the best place for you to get your foot in the door, you know, and at least to have your resume on file with them. That was how I ended up getting my first job in coding, was through a temp agency, okay? Temporary agencies for medical professionals is what you need to Google, so that way you can find if there's an agency near you. Now, I Googled it for the city of Dallas, and I'm not in Dallas, but I saw a lot of them come up, okay? And again, like I said, sometimes these companies, they end up bidding on contracts, and they need people to code for the backlog, and that's a great way to get that experience of coding, and you can get that onto your resume, because once you start having some kind of experience in coding on your resume, that's when you're gonna see your resume start to get some traction, because now, even though you don't have the 2 to 3 years, you still have exposure, you still have training, you still have somebody that got to you before this employer did. So this employer is not going to feel like they need to do training from all the way from A to Z. You know, they're going to have somebody who's already been coding. So you already know the fundamental basics, you know. So that's what I'm saying, that you all need to be doing that. You know, get your resume and name on profile with that temporary agency, so that way they can help you to find a job, and they can help you to get your foot in the door somewhere, because it may be just a temporary job, 90 days, maybe somebody's going out on maternity leave, you know, and so you may have to fill in. Well, now you're starting to make connections as a coder, instead of working any position like patient access, like secretary, like a scheduler, that's not going to help you at all, because there's no connection to coding in those positions at all. There is no connection to coding in those positions at all, okay? So avoid those, you know, for whatever you can, all right? Like I said, it's possible to get a job in coding, but you need to be very careful about where you start, all right? You want to make sure that whatever you choose that is going to help you to build your resume is going to have a legitimate connection to coding, all right? And like I said, I'll talk about the alternative jobs on another video. But with that said, so those are the ones that I really recommend that you all avoid. Don't get into those. Patient scheduler, patient access, any of those types of things, medical secretary, front desk reception. You know, again, if you're working at front desk reception and you're checking in the patients, or you're fielding the calls, or you're directing people, whatever, around the hospital, again, if you have a very good personality, that's where they're going to keep you. They will keep you there. And for those of you who, like I said, y'all love to come out of the woodwork, because I don't know why you would watch a video like this, but whatever. Y'all come out of the woodwork and say, oh no, that was how I got my first job. Okay, well, again, the exception and not the rule, because it doesn't always happen. You're not the one who gets those emails from people who have been in these positions for years, crying when they're telling me that they could never get into coding and that's what they really want to do, but they stopped studying. And now they've been in this position for years and they don't know what to do. Blue, what do I do? Well, you want to do it, you get back into studying. You know, it's that simple. But what are you going to do? You know? So with that said, but yes, those are the ones that I strongly recommend that y'all avoid. Okay? And I'm only suggesting that y'all do that just because it's better for you. Okay? It is better for you to avoid those positions. Because like I said, those employers are going to be looking out for what's best for them. Who's looking out for what's best for you? Think about that. I have nothing. I have no dog in the fight, whether you get a job or not. But like I said, what I'm trying to share with you all is to keep you all from making a mistake and wasting time. A lot of y'all some of y'all like to waste time where it's just like y'all say, oh, okay, well, I'll just do this and or I'll just do that, or I'll volunteer. Well, Blue, can't I volunteer? No, you cannot volunteer. Why? Because if you are not employed with that facility, with that doctor's office, and you're just back there running around willy-nilly looking at that screen, guess what that is? If you don't have a contract with that person, if you don't have a contract with that organization, like these schools do, some of these schools that do these internships, it's a legal process that you got to go through in order to be able to get back there and be exposed to that information. If you don't have that and you're just volunteering because you say that, oh, well, they said that they'll let me volunteer, it's a HIPAA violation for you to be running around back there looking at these records and not getting paid for it because you're not an employee. Do you want to go through that? And the other thing that I should say is this. First of all, who hires somebody to volunteer to use their knowledge in a position, right? When the doctor, the facility, the organization, the practice is going to benefit directly from having somebody who's educated in coding to help them with their work. Does that make sense to you? Does that sound right to you? That you should just give your time so freely? No, you do not give away your time for free. You do not volunteer. You do not intern for somebody and not get paid for it. You do get paid for it. And you make sure that you get paid for it. Don't be like these people that just run around just giving their skill away for free. We work in a multi-billion-dollar industry. Healthcare is multi-billion dollars, right? You're telling me that place can't pay you? Oh, Blue, we don't make money at this facility. Okay, well, whose fault is that? Then you need to make sure that you have trained staff in there that can help you to get where you need to go. So that way you can start getting paid. You know, I had a heartbreaking exchange with a lady. She said she had been working for a doctor for 2 years. She had been his secretary, and she was helping him with the coding because he didn't have a coder, didn't think it was important that he hired a coder, but because she was a secretary, he made her do it. Well, she's wearing, again, 2 hats, and she never got paid appropriately for her coding knowledge. She went through all of that for 2 years with that man. And he never wanted to make her to do anything with the billing, but he just wanted her to do the coding because he had a coding billing company to take care of all the billing part. But he wanted her to do the coding. And because of her, he was able to see better returns on his documentation and everything else. But never wanted her to be in anything else other than the secretary position. And never wanted her to do anything that she wanted to do. And that is not right. And never paid her appropriately. Because when she told me what she got paid and she had been working there for those 2 years, it's heartbreaking. But if you let yourself get taken advantage of, if you let yourself go through something like that, and her the whole time thinking that she was going to get into something better. You know, after that first couple of months when he said, oh yeah, then, you know, you get to do the coding full time and, you know, we'll have somebody else do the secretary. He never switched her over. She should have left. She should have left. Because that's too much. And that's not right. And it's just my advice anyway. So, with that said, guys, you know, you are in control of your destiny in this career field. If you choose to be taken advantage of by working in positions that are not going to help you learn anything about coding, like patient access, medical secretary, you know, doing double duty as a medical secretary, scheduling, you know, that kind of thing. Reception and front desk, these, again, they won't help you. They won't help you. You want a position that will help you. Like I said, avoid these. And if no one told you, I'm telling you now. Okay? That's just my advice again. So, with that said, I'm going to wrap this one up. Thank you guys so much for joining me. If this video helped you, please like, subscribe, and share. And I'll see y'all next time. Bye.